Hi guys, I come your way once again. So you see, every day I talk about documentation in Osce, and just as I said, during your Osce examination, there are three main things they are assessing candidates on, and each and every time we are doing the training, I try my best to catch up with that and let you understand that maintaining sterility. Making sure your patient is safe in whatever you are doing, and also doing what we call proper documentation is one of the key ways to secure a pass in the OSCE, especially in your first sitting. So one thing that is sending people back mostly in assessment is documenting air or oxygen and then putting the A during the disability or the under disability section. You understand? So, because these parameters are not, let me say, vital observations that we check or we use some, electronic system, or we use some apparatus to check, candidates tend to forget that. Remember that when you write your oxygen saturation figure after using the pulse oximeter or whatever to check your patient's oxygen level. Normally in Osce, patients are on room air, so they are not on oxygen. So you have to put A in the column or the space for air or oxygen. And many candidates tend to forget to write this A. It is very important that right after you write in your oxygen saturation figure, you need to put the A over there to make it a complete one. You understand? Again, when you come to the disability, there are four things you need to talk about or check. One of them is checking whether your patient is orientated to place, person, and time. Then, if your patient answers all these questions correctly, then it means your patient is on alert. So you put A in front of what? Alert. If your patient acts confused or if your patient is confused, then you put C. This parameter to or this documentation, many people tend to forget because it's not something that we use any apparatus to check. So the only way or the only better way or the best way in order not to miss this is that right after everything, cross check your documentation very well. And this is how best you can do that. Pick the assessment sheet and then start from date, time. Check one after each other and see if you have what completed all the relevant documentation. So you place your assessment sheet from the date, you slide it down to time, you've written time, you come to respiratory rate, okay, you've documented it, you come to SpO2, it is there, and then what do you call it? The air or oxygen, that one too. You have documented, then you go down, you see blood pressure, okay, I've done the systolic, I've done the what, diastolic in their right ranges. You come down, I've done the pulse rate also in their right ranges, and then you come down, you say, okay, you've done what, the disability, the D, the alert or the confusion in the right place. This is the only way you will be able to determine whether you've left some spaces blank. But especially with the news 2 chart, it's very colorful. So when you look at it at a glance, it's very difficult for you to detect spaces you've left in there. So the best way is to do what I'm saying. Place the assessment sheet from the top, slide it down, checking that you have done all the documentation in all the parameters or all the spaces. But if you think that you can look at the sheet at a glance and get to know that, okay, I have not charted this, I've left this place blank, then I doubt you'll be able to get the blank spaces. So please, let's pay attention to that. It's very important for us to get that and get that correct. So just as I keep saying, we also organize Osce training for registered nurses and nursing associates as well. So if you need this training, just send us a DM. We'll send you the schedule of our next training, where we do online and face to face. Then after the face to face, you come back and do what you call it, a mock test, few days or few weeks to your examination to test your readiness for the examination, which is very important for us. That's why we've planned this to make it, we stimulate the examination process, or what do you call it, the center. You make you have a good feel of how you are going to perform the exams on your test stage. So it's very important that you join our training. and then you benefit from the online class and then study materials, and then you come for the 4 days face-to-face where you are allowed to practice every skill in Osce, and then you come back some few weeks to do your mock. It is very important to test your readiness, and then yeah, thank you.